Virtual PPE orientation. Hi everyone, welcome to this virtual PPE orientation. In this video, you'll get ready for the new normal in the clinical setting. My name is Dr. Philippe Santos, and I would like to welcome you on behalf of myself and Dr. Matlow, who will be co-hosting this virtual seminar with me. This virtual PPE orientation is composed of 3 parts. Part 1 is this seminar that introduces you to the new precautions and landscape since the arrival of the COVID-19 pandemic. Part 2 is a 5-minute video that focuses on human factors that can enhance PPE safety. Finally, Part 3 is a knowledge and skills check that includes a quiz and an attestation of completion. This virtual orientation is designed to accompany in-person simulation training that will be provided by your healthcare site. Our objectives for Part 1 are to provide background information for COVID-19 infection praxis, personal and professional safety, orient learners to patient, personal, and team safety in the new normal for infection prevention and control. COVID-19 has transformed healthcare on multiple fronts. Patients and healthcare workers are having to quickly adapt to new protocols and procedures that aim to create a sustainable, safe environment. The healthcare system is facing unprecedented challenges that are constantly evolving. While some changes already occurred, many are yet to come. A key aspect of this COVID era includes the adequate use of the personal protective equipment by healthcare workers. Previously used protocols had to be adapted to meet the needs of our new reality. Most, if not all, specialties have been impacted by COVID-19. For example, home visits for palliative care now require a whole new layer of protection for patients and clinicians. How will that affect communication? How will physical distancing impact empathy? How can we meet the growing need for early, frank discussions about goals of care with patients and their family? While many clinical interactions will now be virtual, how do family doctors adapt to well baby visits and the need to maintain vaccination schedules? How do healthcare workers balance personal protection and the need for everyday life-saving procedures that carry a high risk of transmission of respiratory pathogens? Finally, what is the long-term toll the pandemic will take on mental health, and how will clinicians deal with these new challenges? We certainly don't have all the answers, and these are just a few examples of the impact the pandemic has had and will continue to have in healthcare. Through this virtual seminar, we will provide you an overview of what we do know, and that will allow you to explore this unknown territory as safely as possible for you, your patients, and the healthcare team. Importantly, we ask you to be open to changing practices. Resiliency and flexibility are important skills that will help you unlearn and learn as the field rapidly evolves. Next, Dr. Matlow will review the basics of infection prevention and control for the clinical setting.
Hello, my name is Dr. Matlow. Today I want to lean on my experience from the SARS and H1N1 pandemics to remind you about the importance of infection prevention and control in your daily clinical practice. We will discuss what has changed since COVID-19 arrived, particularly as it relates to respiratory precautions. Healthcare organizations and clinical spaces are full of people, including patients, healthcare workers, and visitors, and each brings his or her microbiome to this setting. Some microbes are usually colonizers, such as Staphylococcus epidermidis. Some are pathogens, like Clostridioides difficile. Being surrounded by bugs is a way of life, and in fact, an occupational risk for all of us involved in the delivery of healthcare. And just like with any risk, strategies have to be in place to reduce the risk and control the consequences. Take a look at this picture of the chain of infection. A coughing patient will always have a significant portal of exit for an infectious agent like influenza. A patient with an open wound has a portal of entry for an agent like MRSA. Unfortunately, we don't always know where the reservoir for the organism is because an index case may be asymptomatic. To break the chain of infection, standardized infection prevention and control practices must be in place. Before we go into these standardized practices, let's take a step back and look at infection prevention and control in its broader context. Much of the responsibility for protecting the healthcare worker rests with the employer, including established policies and procedures and the availability of PPE. It is, however, the responsibility of each healthcare worker to use infection prevention and control measures, to know what PPE is indicated in which situation, and to use it appropriately. The basic infection control precautions used in patient care are known as routine practices. They include hand hygiene, cough and sneeze etiquette, sharp safety, and aseptic technique. The use of PPE is also part of routine practices when exposure to blood, body fluids, secretions, excretions, and non-intact skin is anticipated, even without a known pathogen. We add extra transmission-based precautions to routine practices when the patient has an infectious syndrome, for example, pneumonia, or infection with a known pathogen, such as MRSA. This diagram shows the major categories of transmission-based precautions, the PPE required for them, and examples for each. Knowing the mechanism of transmission of infectious pathogens will help you break the chain of infection. For example, when taking care of a patient with C. difficile, you will need contact precautions with gown and gloves because of potential transmission through fecal contamination. Some respiratory viruses, like influenza and SARS-CoV-2, can also be acquired from contaminated surfaces in the environment. Therefore, you must use a combination of droplet and contact precautions for the routine care of patients with these infections. COVID-19 has turned our approach to basic infection control precautions on its head. Pre-COVID, if you were seeing a patient with hypertension in the cardiology clinic, you would have sanitized your hands and gone in to see the patient without donning PPE. But with the arrival of COVID-19 and the knowledge that asymptomatic and pre-symptomatic patients can transmit infection, basic infection prevention measures have now been enhanced. While details may vary from facility to facility, you would likely now don a mask and eye protection before seeing the same patient. In other words, the new normal for routine practices includes droplet precautions. Management of aerosol-generating medical procedures, abbreviated as AGMPs, requires consideration of infection prevention in COVID-19. For the rest of the slides, we'll use the term AGMP. Routine PPE has also been modified for the care of patients undergoing AGMPs. With the advent of COVID-19, you must use an N95 respirator, eye protection, gown, and gloves when participating in AGMPs, including protected code blue. AGMPs are characterized by generation of virus-laden aerosols less than 5 microns in diameter, which are filtered by N95 respirators. Patient care is complex, and there are many considerations that go into selecting the proper PPE for a specific patient encounter. Before seeing a patient, pause and ask yourself, what symptoms does the patient have? What is the diagnosis? And what will be the nature of the interaction with them? For example, does that hypertensive patient admitted from clinic a week ago have a new fever, cough, or shortness of breath? If COVID-19 is a possibility, you will have to enhance your routine practices by instituting droplet contact precautions. Remember, patient diagnoses evolve over time, and you must be open and prepared to update patient infection prevention and control practices accordingly. In summary, Attention to the use of PPE is now a significant part of our daily clinical practice, and protocols will vary according to your workplace context and healthcare sites.
So I'm here to tell you what's next. In part 2, the PPE safety video, you will learn about the importance of visual aids, the buddy system, and a culture of safety to optimize adherence to PPE protocols. Remember, part 3 is the knowledge and skills check. Thank you for your attention.